The liver helps purify the blood by changing harmful chemicals into harmless ones. Typically, these harmful chemicals are broken down into smaller chemicals that then are eliminated from the body in the urine or stool. Many illnesses and conditions can cause inflammation of the liver. Hepatitis means inflammation of the liver commonly caused by a viral infection, but there are other possible causes of hepatitis. These include autoimmune hepatitis and hepatitis that occurs as a secondary result of medications, drugs, toxins, and alcohol. A different virus is responsible for each type of virally transmitted hepatitis. Some forms of hepatitis are mild, and others can be serious. Some can lead to scarring, called cirrhosis, or to liver cancer. Types of viral hepatitis. Viruses that attack the liver are called hepatitis viruses. All viruses cause hepatitis, but certain viruses cause about half of all hepatitis in people. There are several types of hepatitis viruses, including types A, B, C, D. Types A, B, and C are the most common. There are non-viral hepatitis caused by alcohol or autoimmune system. Hepatitis A. Hepatitis A is always an acute, short-term disease caused by an infection with the hepatitis virus HAV. This type of hepatitis is most commonly transmitted by consuming food or water contaminated by feces from a person infected with hepatitis. Hepatitis B. Hepatitis B is most likely to become ongoing and chronic and is transmitted through contact with infectious body fluids, such as blood, vaginal secretions, or semen, injection drug use, or sharing razors with an infected person containing the hepatitis B virus HBV. Hepatitis C. Hepatitis C is also most likely to become ongoing and chronic and comes from the hepatitis C virus HCV. Hepatitis C is transmitted through direct contact with infected body fluids, typically through injection drug use and sexual contact. Hepatitis D, also called delta hepatitis, is a serious liver disease caused by the hepatitis D virus HDV. It too can become ongoing and chronic. HDV is contracted through direct contact with infected blood. Hepatitis E. Hepatitis E is usually acute but can be particularly dangerous in pregnant women, typically resulting from ingesting fecal matter that contaminates the water supply caused by the hepatitis E virus HEV. There are some hepatitis that are not viral. Alcohol and other toxins. Hepatitis autoimmune system response. Hepatitis alcohol and other toxins. Hepatitis is sometimes referred to as alcoholic hepatitis. Over time, it can cause permanent damage and lead to liver failure. Other toxic causes of hepatitis include overuse or overdose of medications and exposure to poisons. Autoimmune system response. Hepatitis. In some cases, the immune system mistakes the liver as a harmful object and begins to attack it. It causes ongoing inflammation that can range from mild to severe, often hindering liver function. Symptoms of hepatitis. When the liver is inflamed, it does not perform its functions well, which brings about many of the symptoms, signs, and problems associated with any type of hepatitis. However, most people who are infected with the hepatitis B or C virus do not develop symptoms. Symptoms of acute viral hepatitis include fatigue, flu-like symptoms, dark urine, light-colored stools, fever, and jaundice. However, acute viral hepatitis may occur with minimal symptoms that go unrecognized. The symptoms of chronic viral hepatitis often are mild and nonspecific, and the diagnosis of chronic hepatitis often is delayed. Diagnosis of hepatitis. Acute hepatitis is easier to diagnose as its symptoms show early, but from a diagnostic perspective, the complexities of chronic hepatitis infection are challenging as it does not show any symptoms in its early stage. Diagnosis of viral hepatitis is based on symptoms and physical findings as well as blood tests for liver enzymes, viral antibodies, and viral genetic materials. Ultrasound testing can be used to exclude the possibility of gallstones or cancer. Treatment of hepatitis. If you think you've been exposed to viral hepatitis, seek immediate medical attention. Treatment options vary depending on whether the infection is acute or chronic. Antiviral medications are used to treat both acute and chronic forms of hepatitis. Hepatitis. The hepatitis B usually doesn't require treatment because it's a short-term illness. Bed rest is recommended if symptoms cause a great deal of discomfort. The hepatitis A vaccine is available to prevent this infection. Hepatitis B. Acute hepatitis B doesn't require specific treatment. Chronic hepatitis B is treated with antiviral medications. Hepatitis C. Antiviral medications are used to treat both acute and chronic forms of hepatitis C. Currently, there is no vaccination for hepatitis C. Hepatitis D. No antiviral medications exist for the treatment of hepatitis D at this time. Hepatitis D can be prevented by getting the vaccination for hepatitis B, as infection with hepatitis B is necessary for hepatitis D to develop. Hepatitis E. Currently, no specific medical therapies are available to treat hepatitis E because the infection is often acute. It typically resolves on its own. Autoimmune hepatitis. Corticosteroids, like prednisone or budesonide, are extremely important in the early treatment of autoimmune hepatitis. Azathioprine, a drug that suppresses the immune system, is often included in treatment. Complications of hepatitis. If the infection is left untreated for many years, some people with hepatitis will develop scarring of the liver. Over time, this can cause the liver to stop working properly. When your liver stops functioning normally, liver failure can occur. Chronic hepatitis B or C can often lead to more serious health problems. Because the virus affects the liver, people with chronic hepatitis B or C are at risk for chronic liver disease, cirrhosis, liver cancer, bleeding disorders, a buildup of fluid in your abdomen, known as ascites, increased blood pressure in portal veins that enter your liver, known as portal hypertension, kidney failure, hepatocellular carcinoma, which is a form of liver cancer death. Some patients rapidly become comatose. Mortality is as high as 90%. Prevention of hepatitis. You can prevent some forms of hepatitis through immunizations and lifestyle precautions. In general, you need to be aware that how to stay safe of the virus. Hygiene. Practicing good hygiene is one key way to avoid contracting hepatitis A and E. Avoid drinking unclean water. Avoid eating raw or undercooked meat. Hepatitis B, C, and D contracted through contaminated blood can be prevented by not sharing drug needles, not sharing razors, not using someone else's toothbrush, not touching spilled blood. Hepatitis B and C can also be contracted through sexual intercourse and intimate sexual contact. Practicing safe sex by using condoms and dental dams can help decrease the risk of infection. Vaccines. The use of vaccines is an important key to preventing hepatitis. Vaccinations are available to prevent the development of hepatitis A and B. Home remedies of hepatitis. When we get sick, we want to get well quickly. Some of us turn to our doctors first, while others may try home remedies or alternative medicine. Many of us do both. Natural medicine means that no chemicals, drugs or surgeries are used to help you get well. Turmeric milk in warm milk and put turmeric powder to it. Mix it very well and consume this turmeric milk. Garlic. Peel off garlic closed skin and munch them in the early morning with an unfilled abdomen. Do this procedure in every morning hours to heal the hepatitis. Carom and cumin seed. Dried roast carom and cumin seeds properly and mash them to receive powdered form separately and mix them in a bowl. Then put a pinch or tiny of rock salt to it and mix it well. Take this kind of spice mixture in powdered form by taking them with a glass of water. Milk thistle extract. Milk thistle extract consists of silymarin, a good flavonoid that is shown to aid in recovery and restoring the liver. Get 200 to 400 milligrams 3 times every day. If you liked the video, please subscribe, like, comment,